In a recent Truth Social post, Trump made this statement, quote, "I'm not running to terminate the ACA as crooked Joe Biden, Buden, disinformates and misinformates all the time," end quote. Why would crooked Joe Biden make such a claim? Well, because it's true. In 2017, House Republicans passed legislation revoking the ACA, referred to as Obamacare. Trump endorsed that effort and celebrated the House vote by summoning the House Republicans to a Rose Garden event for a victory celebration. Trump's effort to repeal Obamacare failed in the Senate when John McCain voted against the repeal. Trump started to attack McCain then and ever since for voting no on repeal. Trump criticized him last January at an Iowa rally for voting against repeal. Trump then reiterated his position that he will repeal Obamacare and replace it with something that is cheaper and better. Cheaper and better for healthcare plans is an oxymoron. It's just so ridiculous. It's unbelievable that anybody would even believe that. The House Republican Study Committee, that includes 80% of the House Republicans and its leadership, published the Republican proposal on health care last month. I took a look at it. Their plan would repeal the ACA and restructure Medicare into a private insurance program similar to what almost every House Republican voted for in 2011. That earlier failed attempt to repeal traditional Medicare would have resulted in those who were then 55 in 2011 paying health care premiums more than twice what seniors who were still on traditional Medicare as calculated by the nonpartisan Congressional Budget Office. The CBO calculated that the annual premium on the GOP proposal would be $12,500 in 2022, the first year when those who were 55 when the plan was proposed would become eligible for benefits at 65, compared to those still on traditional Medicare who would be paying $5,630 as an average premium. The difference would increase between those on traditional Medicare and those receiving vouchers to purchase private insurance under the GOP plan as time went by. The purpose of the Republican plan was to shift costs from the government to individuals. My opinion then, as expressed in a July 15, 2011 post, which included a snapshot of the CBO's projections, was that the Republicans were trying to bankrupt their middle-class supporters in their golden years. The plan also called for significant tax cuts for the Republican megadonors. So that was the plan in 2011 on how the Republicans were going to save America, but they could not be honest about it then or now, since their current plan is a rehash of what they tried in 2011. The House Republican Study Committee Blueprint for Healthcare, released last month, would repeal the federal protections established for people with pre-existing conditions, allowing the states to decide whether to keep that kind of provision. It would repeal the ACA. It would transform Medicare into a premium support or voucher system as a substitute for the federal government directly paying health care bills. The Republican health care plan also calls for rescinding Medicare's authority to negotiate drug prices in order to lower them, and the Republicans proposed to end Medicaid and instead bundle that program into a block grant for states along with a separate federal program that covers children. The entire thrust of the Republican health plan in 2011 and now is to shift the health care costs from the federal government to individuals. Trump knows that his supporters, at least those who may be concerned about the repeal of traditional Medicare or Obamacare, will remain uninformed and will actually believe him when he says that his health care plan would be better and cheaper for them. Trump has clearly and repeatedly stated his intention, as have many Republican politicians in Washington, to repeal Obamacare and to end Medicare as we know it by substituting in its place a voucher program where seniors that would be eligible for Medicare have to purchase private health insurance and receive a grossly inadequate voucher for the purchase of health insurance, particularly those with pre-existing conditions. How many times do Republicans have to state their intentions before Trump supporters actually believe that this is their plans for them? Their plan now is the same as it was in 2011. The goal is to repeal Obamacare now, to reduce federal spending on health care, and to transfer costs, particularly inflation in those costs, to individuals, thereby reducing federal spending on those programs.